Welcome to Behind the Screen, a podcast series from BreastScreen Victoria. I'm your host, Dee Mason, and this is our sixth and final episode in this series. Today, I'll be catching up in studio with BreastScreen Victoria's CEO, Rita Butera. We'll be discussing the impact of this podcast series so far and what BreastScreen Victoria has planned for the rest of 2026 and beyond. Rita Butera, welcome back to Behind the Screen.
Thanks, Dee. It's a pleasure to come back and talk more about the wonderful episodes that have taken place in the podcast.
It feels like I haven't seen you for 5 episodes.
Yes, that's right.
And we've covered so much ground between episodes 1 through 5. Have you had an opportunity to get any feedback from listeners or staff and colleagues about it?
Look, there's been really, really strong engagement, really pleased with the engagement. And the content has been really quite deep, much deeper than what people are used to hearing. And it's been really positive having some experts, some people on the ground speaking. So you get a real taste and a real sense and a real feel of what it's like to come in for a breast screen, to go through an assessment and experience that whole journey through the program.
And it's been really interesting for me to get feedback from people that I know about, I've never had a breast screen. I'm like, what? It is encouraging people to go and get screened, and it is giving people more information. And it's been really interesting to meet fascinating, hardworking, kind people that are making a difference. And I think that if people haven't listened to the series, I'd encourage them to go back, start at episode 1. No spoilers. Go right through to episode 5 and check it out. What have been your highlights, if I can put you on the spot, Rita?
I think the highlights for me have been listening to people who work in the program talk about the program and their experience of it and their experience with the clients that come in and the difference it makes to their lives. For example, listening to Dr. Speakman talking about the assessment journey and how important it is for women who come in very anxious to learn and understand what the procedures are and how it works and the benefits that come from that whole process.
Well, that episode 2 with Catherine Langford as well, they really just went through. I mean, we had 2 clinical experts there, or two people involved in the supply explaining the process, but then we also had the benefit of Liz Naval explaining her experience with the service as well.
Yeah, and it's really important, and the consumer's experience is what helps us learn in terms of how do we improve the service, how do we make it more appropriate for you. It's really important that we listen to the voice of that lived experience in the program. There are cases where we find cancer and support women in their journey to treatment, and for probably 95+% of everybody who comes through a screen, it's a clear result. So it's for that small percentage that come through to assessment, extraordinary caring team of people across the whole of Victoria who support women through that journey.
What are some examples of the kind of feedback that you've received on the podcast series so far?
Well, it's really interesting. People who I thought would know a lot about BreastScreen and understand it actually have come to me and said, wow, I've really never really understood what having a category D really means in my BreastScreen. And now we do advise all women on their breast density in Victoria, and this is a new thing. And if you do have a category D, it means it may be harder for us to see the cancer in the mammogram. We are now able to let the women know, empower them to go further and find more help, go to the GP, talk about it, because there may be other types of tests that are probably more suitable for women with that D category.
That's really interesting conversation that we had with Dr. Speakman in episode 2, where he talks about not only does having a denser breast mask the cancers, but it also increases the likelihood of a cancer. So he explains it very clearly and very well. But you're right. If having something as simple as a podcast can encourage women to go, oh, I didn't know that. I'll find out more about that. That's great. Can I give you some of my highlights? Because there's very, very many. And I know I've been talking with your team here today, and we're talking about the one that impacted us all, which is episode 4, Aboriginal and Torres Strait Islander women. We had Auntie Jill Gallagher in talking about the Beautiful Shawl Project. Auntie Jill, of course, from that show. We talked about cultural safety, and we talked about women being shrouded in their culture. But it's the bit that I think that gets to everybody in that story is when the Indigenous women then regift the idea of this cultural safety about the shawl back to the non-Indigenous women of Victoria. It's a very moving story and so well told by Auntie Jill and Auntie Deb Mallet also.
We've had a wonderful relationship with Jill and her team in building on the Beautiful Shawl project, and it's been really important for us to learn also how we co-design, work together with different communities to create a program that actually is culturally safe, that works for that community, and it's got a lot more Aboriginal and Torres Strait women now screening with us, which is really exciting across the whole of Victoria. So the Beautiful Shore was a beautiful initiative, and the fact that we now can share that across the program is a real highlight.
She talks so proudly about cultural safety, but also about ways of sharing her culture with the rest of us. It's great. My favourite line from Auntie Jill in that podcast is that we were talking about how can we come up with ways and what data can we use to encourage more Indigenous women to get screening. She goes, well, I'll go and pick them up.
Yeah.
Which is great. I'll go get them.
Yeah, fantastic.
Which is fabulous.
Yeah, love
and I
it.
was like, oh, why didn't I think of that? The other very special mention is episode 5. It's on innovations shaping the future of screening. Dr. Helen Fraser talking about the AI program, which we'll talk about in a little bit with you. But I thought it was going to be about machines that go bing, new technology, things like that. But it was really interesting, even talking to Luke Neal, the Chief Operations and Innovations Officer at BreastScreen, about how simple things that you might think are quite mundane or ordinary, like access to weekend appointments and women being able to text to say that they're cancelling an appointment, thus freeing it up for somebody else. Like little innovations like that are really pushing the needle forward in terms of increasing participation, which is ultimately what we want, right? But also Helen Fraser, I can't even begin to explain how groundbreaking the work that she's doing is, and it's worth having listened to episode 5 for that alone.
Absolutely. When I first joined BreastScreen 3.5 years ago, I came to a program that was running really, really well, doing what it's done for 30 years really well. But there wasn't so much room for the innovation. And so it's been really exciting to see how can we make a little bit more difference in making services more accessible, more available. We have a lot of working women that can't get to screens during office hours. How do we build capacity after hours? How do we get our van out to more places? How do we create more clinics? With the support of funding, we've been able to sort of really expand the number of clinics across the state as well. So there's been a lot of work in making some of those improvements. But the AI work that Dr. Helen Fraser is leading is very exciting. The first time I heard her speak, I thought, wow, now that's something we need to do. And it's been really exciting to see her vision be realised in the program. It's one thing to do research outside a program, but it's implementing that research into the program is where the challenge is. And we've been able to work with St Vincent's and Helen to actually embed that.
You're right, because an organisation needs to have its business as usual running very well in order to have the scope to innovate. And that's what we're getting to. Like, you have to be providing the services that you're there to provide very well indeed, that you're running smoothly, to have the time and the scope to innovate. And that's the episode 5 shows it in spades. It's extraordinary. And yes, I also adore Dr. Helen Fraser and her nerdery. She's an out and proud data nerd, and I think that's an extraordinary asset to have in the organisation. Look, one thing that hasn't changed in the last couple of years is the ultimate goal of BreastScreen Victoria. Do you recall what it is? I'm sure you have to say it daily.
Well, it's all about working towards no deaths from breast cancer in Victoria.
I think in episode 1, I facetiously said to you that I thought that was a bit of a lofty goal, no deaths from breast cancer in Victoria. I mean, you were good because you fought back and you gave me a good reason why I was wrong. I've had the opportunity to talk to so many people about it, and it's become very clear in my mind that I was confused between diagnosis and mortality. I think I said to you, how can you presume to cease all deaths from breast cancer when you're not involved in the cure of cancer or the treatment of breast cancer? But now it's patently clear to me that your goal is to drive people towards screening, which is to drive the results of early detection, which is in turn the outcome of good results, surgically or otherwise, which actually can prevent deaths from breast cancer. We're probably not going to stop people being diagnosed with breast cancer.
No, correct.
There's somebody's working on that, but you're working on stopping deaths from breast cancer by what?
Well, it's all about, as you said, screening and early detection. So the more people that we can get through the door to screen, to find any cancer early, the more lives that we save. Because of the outcomes, the health outcomes are really strong. While our job is screening and early detection, again, just to acknowledge that together with amazing treatments for cancer, together there is a real possibility that we can work towards no deaths from breast cancer.
So 2026 is off to a great start. You've released the podcast series Behind the Screen. Tick for that. We know that there's a lot on the slate for BreastScreen Victoria. What do you see as your priority areas for the rest of 2026?
Well, we're working in the first year of our new strategic plan, and the real focus is actually getting more people to screen, getting more people through that front door, booking for a breast screen. We also have started rolling out the AI in the program, so there's a lot of work to be done in that space. But I think more importantly, we're not screening everybody equally in terms of our population. So we're putting a lot of emphasis on equity. How do we make sure that the harder to reach people get the same opportunity to come in for a breast screen?
Yeah, we haven't really talked about that in our highlights, but that is also an excellent episode. Episode 3, Hard to Reach Communities. And we really talk about what the difference between equality and equity is. Eliza Elford, who's program manager at Bendigo BreastScreen, does a great bit on explaining that and talking about why it's important to give, not just because the screen is free and accessible, doesn't mean that it's accessible equally to all. So equity is a really important priority for BreastScreen Victoria.
It absolutely is, because for a lot of people, it's not the same in terms of getting access to that service. So, for example, in sort of reaching women with disabilities, how much more do we need to do to make sure that they have the equal access to that program? Even in reaching some of our very rural, remote communities, what can we do more of to make sure that they've got an opportunity to access that program? So it needs a much more targeted approach in those circumstances.
When we first talked in episode 1, you talked about how in this job you've seen more data than in any job you've ever had. You're surrounded by data.
Yeah, absolutely. There's so much data, so there's a lot of stories that we can tell.
But it's important to what you do, because you're aiming to get, is it 55% of the eligible population that you want to screen?
That's where we're heading.
And what is the eligible population?
From the age of 50 to 74, you're eligible to come and get a breast screen.
Right, so of all the women aged from 50 to 74, we want to be screening at 55% of those women. Last time we spoke, the rate was 51.9% or thereabouts, just under 52%.
Yeah.
Where are you screening at right now?
Well, really pleased to say that we're now at 52.5% of the population.
Let's not forget, that's not of a static population number. Your data set of the eligible population is rapidly growing as Australia ages. So you've got a growing cohort of ageing women. No offence, I'm one of them. But you're screening at a higher rate of a higher population.
Absolutely.
So it's actually quite a deceiving figure, because it's actually you're outstripping it.
Absolutely. And so just to keep to the participation rate that we are at the moment, we actually have to screen some 8,000 to 9,000 more women.
Just to keep up?
Just to keep up, yeah. And I think it's also important just to make a note that if you're 40 as well, you are eligible to come to the program.
Rita, in episode 5, we discussed the AI reading trial that Dr. Helen Fraser was talking about, and she walked us through the research and the potential applications. Are you able to summarise just ever so briefly, to entice people back to episode 5, what is the AI trial about?
It's been Dr. Helen Fraser's vision for some time to look at how AI can help in finding cancer and how we can implement that into the program. So we're working with St Vincent St Helen to actually embed the AI trial, it's a randomised control trial, into our programs. The way BreastScreen works is there are 2 radiologists who read every single screen for every woman that we screen, and they blind read it. They don't see the results. And if there's any disagreement on that outcome, there is a 3rd human radiologist, more experienced, who has a look at that and makes the final call. It's very workforce intensive, very specialist medical profession. So what we're doing in the AI project is taking one of the human doctor readers out, so there's always a human in the program.
Which is so good to know, because I think a lot of people, and I was itching to say it, a lot of people say AI, I'm so scared of that.
Yeah.
You know, I think I said to Dr. Helen at the time, I've got a chat GPT that messes up really the most basic stuff. So it's a different kind of AI.
Yeah, correct. And it's been built on our own data, and I think that's what's really significant in this trial. At the moment, we've had about 4,000 clients who have gone through the trial. We expect that we will have a quarter of the population involved in the trial in a few months. And once the trial is complete, that we would potentially roll it out across the state.
So, of course, with BreastScreen Victoria, as with all your client interactions, data security and privacy is paramount. How does that work in terms of this trial?
Cybersecurity is front and centre for BreastScreen in terms of maintaining privacy, security of all health data. So at this stage, we've got 4,000 clients who have actually gone through the program. And as time moves on and we make sure that the results are strong, we will eventually roll that out across the state.
Yeah, and people can opt out if it's not for them.
Absolutely.
And there's no difference in the screening process.
It's just in the reading. It's behind the scenes. It's in the reading. And in fact...
It's behind the screen, Rita.
Behind the screen. Absolutely.
No, it absolutely sounds fascinating, Rita, and I will encourage everybody to go back and listen to episode 5 on innovation, because it's not just Dr. Helen's bit, although that's extraordinary. There's also other stuff happening in terms of 3D mammography, lots of innovation happening at BreastScreen Victoria. BreastScreen Victoria invites women and trans and gender diverse people aged from 50 to 74 without breast symptoms to have a free 10-minute breast screen every 2 years. Breast screens with us are performed by a woman radiographer and don't require a doctor's referral. With over 50 clinics and 2 mobile screening services across the state, you can choose a clinic and a time that's convenient for you. Book at breastscreen.org.au or call 13 20 50. Everybody loves the big pink buses. We talked with Eliza Alford, who's Program Manager at Bendigo BreastScreen, and also Auntie Jill Gallagher in episode 4 about the importance of the vans in being able to reach women in rural and remote communities. But they've also been utilised in other hard-to-reach communities and in metropolitan areas. I know my last screen was here. We had at the Pride Centre, we had the vans here for the rainbow sessions. You've got 2 vans currently, and I don't know a lot of people know this, but the vans have human lady names. Can you tell us a bit about their names?
We have Nina and Marjorie, both named after radiologists who started the program.
Oh, that's fabulous.
Yeah, amazing women.
Is it possible to track where the vans are going? Can I find out where the bus next is?
Absolutely. That's also available on our website, so you can see and make an appointment to get a screen on the website.
The success of the mobile screening vans has led to talk of an expansion into a program aimed at improving access and equity for women's health more broadly.
Yes.
Now, we talked about sticking to your knitting and getting good at the thing you do before.
Yes,
how does expanding from breast health to other women's health impact your role and the job of BreastScreen Victoria?
Very good question. What BreastScreen Victoria does really well is the mobile van, and we've been doing mobile health services for a long time, and it works really well. So when the Victorian State Government was looking at a mobile, broader women's health van for all things women, they came to BreastScreen to see if we would partner to deliver a broader health program to women in rural areas, which is what we're already doing and doing well. So it made a lot of sense to build that program. So we now have a nurse practitioner on that van, on Nina. Nina is very famous.
So you're using Nina already for this new project?
We are correct, yep. So Nina does BreastScreen, as Nina always does, but as well as that, there is a nurse practitioner that sees anybody in a local community, in a rural community, from any age, young people, 18-year-olds, school kids, to older people, for a free appointment.
And the Department of Health has seen that BreastScreen Victoria is doing an amazing job reaching out to regional and rural communities and other hard-to-reach places, broadening it out to broader women's health. What kind of things will the van be able to offer to those communities?
Well, it can offer a range of services. You know, anybody can go in. If you haven't had a pap smear or a cervical screen, you can go in and see the nurse, and it is self-collect now, so you can be supported with that. Also, information about bowel screening, so the kits are available also on the van, and also information and referrals for lung screening, which is now also a screening program in Victoria.
It does make sense, I think, if you've got the infrastructure and you're doing an amazing job at getting out there, to actually partner with other organisations to offer other things. It's really a mobile women's health clinic.
Absolutely. And you could be of any age to use that service. So we have, young women coming along to talk to the nurse. So reproductive health is a really important feature of the van.
Well, it sounds like you're going to need another van, Rita.
It's interesting you say that. We're actually really pleased to say that we are building a new van.
Have you got a name for it?
Not at this stage.
Will it be a lady van?
I
have to be.
I hope so. We haven't got to that stage yet. So at this stage, we're just speccing it out to build it.
So plans to have another van, a third van for Victoria. What's going to be special about this van, different to Nina and Marjorie?
Well, this van will focus on equity. and it's really about reaching those that don't get access to screening. So it will be focusing mainly in metropolitan areas of Melbourne, and it could be with local communities, it could be with community health services. We will partner to see how we can engage people to get onto the van.
One thing that you do very well is partnerships, and I know that through your partnership with VACCHO and the amazing Beautiful Shore project that's emanated from that. So what kind of partnerships would work with BreastScreen Victoria and this equity van?
Well, at the moment we're looking at a partnership with North Richmond Community Health Service to look at how we bring the van closer to their clients and provide screening for those women who may not ever think about screening for breast cancer.
When do you think it'll roll out?
Well, we're hoping in the next 6 to 9 months it will be complete and we'll be rolling it out.
It's such a great aspect of what I've learned about BreastScreen Victoria is the way that you can partner with other organisations to get better results, not just for your aim, which is higher participation in screening, but also their aims. Your partnership with VACCHO and Auntie Jill Gallagher and working on the Beautiful Shore project has been, I mean, as we've seen now, not just helping the Indigenous community in Victoria, but it's now rolled out to help the non-Indigenous community as well. And if you're interested in that kind of idea, go and listen to episode 4. It's an incredible story, well told.
And I think just to mention another community that I'm particularly interested in is how we reach women who are homeless and what agencies do we partner with to reach those women. You'd be surprised how many people just love the idea of partnering and getting that pink van out there and, providing mammograms to clients that we wouldn't otherwise reach.
In episode 1, yourself and Dr. David Speakman and also Sue Viney was in that episode, and we had a little game at the end of the episode where we talked about frequently asked questions or myths and misconceptions about breast screening. We covered off on a number of them that I'm sure you've heard before, but I heard one recently that got me wondering, and I wonder if you've heard it as well. I was at a dinner party with a number of, I would say, upper middle class women of a certain age, and breast screening came up as it does annoyingly when I'm at a dinner party lately. And most of the women there, more than half, said, oh no, we do it private, because they thought that by going through the free public service that they were taking spaces of women that needed it more, which is a really interesting mindset. Have you come across that before? People think, oh, I won't take the free service, I'll do it private because I can afford it.
It's interesting. Look, I think around 10% of women in Victoria do go private for all sorts of reasons. And if they can afford to pay, then that's fine. But the service we offer is free for anybody.
I mean, you're not overstretched to the extent that you can't screen all the women that need to be screened.
No, any woman in that eligible age group is eligible to come in for a free mammogram.
Takes 10 minutes, it's free.
Yes.
And it could save your life.
Yeah. And I think the thing about the BreastScreen Victoria program is that everybody involved in the program is very passionate about what they're doing. They're there because they love doing mammograms and servicing women, and become very specialised in the service as well because they're doing that every day. Great.
You've got a lot of great employees.
Yeah, it's just, every day I see that every day, and it's just wonderful to see.
And not just employees, but you've got a lot of women that have gone through the system that come back and they work with your client networks. Just tell us about, if somebody's listening and they want to get involved in that or they want to give back to BreastScreen Victoria, how would they go about it?
There's so many ways you can get involved. We have a consumer network. It's got thousands of women involved. You can actually become a member of that network, stay engaged with us, stay connected. We provide updates, we provide information, we'll let you know if there's certain research going on, you might be interested in participating. So it really opens that communication and that door. And sometimes we're looking for consumers to participate in special projects of some sort. We put the expression of interest out to that group, get some amazing women involved. It just surprises me every day how passionate consumers are to stay involved with the program. The
great thing that the Consumer Network's given you is ambassadors for your brand, and women that are prepared to talk about their story, their journey through breast screening and perhaps even into breast cancer, like Liz Naval, who spoke to us in the Assessment Journey episode 2. Yeah. So how important is the lived experience in what you do?
The lived experience is really central to what we do because it's the women that we screen, and their story really resonates with other women as well. So it's really important that that story is told, and that the women who want to be a part of our program get to tell their story as well.
I can't imagine if anybody's listened to all 5 and now 6 episodes of this podcast series that they wouldn't have got the full message. But can you reinforce it for me, Rita? Who's eligible for breast screening and how do they arrange one if they haven't had one?
Well, look, you are eligible from the age of 40 to book online and get a screen. But we invite you from the age of 50 to 74 to come for a screen. So that's really the targeted age group from 50 to 74 where we find most cancers. Now, women who may have a symptom, BreastScreen Victoria is not the service for you. If you have any form of symptom or anything you're worried about, the GP is the best person to go to.
And that's because that they can prescribe a bunch of other tests.
Absolutely.
And I think Dr. David Speakman explains that very well in episode 2. He talks about why young women are not the best, and it's to do with breast density and the way they present, and why people with a symptom really need to go to their GP directly. Rita, thanks so much for your time today. I know that you've got a lot on your plate. Well, we all know because you've just told us how much is going on there at BreastScreen Victoria. But thanks certainly from me for the opportunity of sitting with you on episode 1, finding out what the aim is, what the goal is for BreastScreen Victoria, and having the chance to meet all of those amazing people that are working with you and on the project. I've thoroughly enjoyed it. So thanks again for coming along today.
Yeah, thank you. And look, also, I want to thank you, Dee, for championing the program and supporting us through it. It's been, without your involvement, we wouldn't have been able to achieve this. So a super thank you. And also a thanks to Joy Media, who have welcomed us with open arms to do the program. And I must also mention everybody that's been involved in the podcast.
Great guests.
It's been absolutely fantastic. I also want to thank our wonderful consumers who have been involved, in particular Sue, Liz, Kathy and Carmel. A super thanks to them and for giving their time to the program. We're very, very lucky.
Big thanks to my guest today, Rita Butera, CEO of BreastScreen Victoria. And thanks to all of the guests who have been part of the Behind the Screen podcast series. If you've enjoyed Behind the Screen, make sure to like, follow and subscribe, and to keep the conversation going on Instagram and Facebook. If you know someone who's curious about breast screening or could really benefit from these conversations, please do feel free to share. I'm Dee Mason, and this has been Behind the Screen.